You're an FY2 in a GP surgery. A 65-year-old man has presented with some concerns. So no presenting complaint is given. When you go inside, you tell the doctor, I have problems starting to walk, or I've got problem initiating, movement. But once I start walking, I am okay. So he has difficulties holding on to the chair as well, to stand up from the chair. Why? Because he has got tremors. That makes it difficult for him to hold to things and standing up. Okay, you have to be very careful, difficult standing up from the chair, people making a diagnosis of polymyalgia rheumatica in here. So you have to take the whole history and put the whole history together. So he has had tremors of the right hand, especially of the right thumb. The whole problem started about 3 to 4 months ago. His father had Parkinson's disease and he passed away about 10 years ago. Okay, his main problem in all of this is initiating movement. Starting to walk is one of the biggest problems he has. He has good questions for you. Why did I get this condition? Will my son get this condition? What would you do for me? So approach the task, grips as usual. Okay. Now remember, we're going to follow the whole approach, which we normally follow already, the whole approach. So just to recap in here, it's grips. Yeah. Then you're going to take the history of the presenting complaint. The history of the presenting complaint, yeah. I'm going to look through the DDs. Yeah, I'm going to do the pimafloza. The effects of symptoms, the eyes, and we'll summarize. Yeah. Good. So that's what we're going to follow, which we're always following all the time. So let's talk a little bit about the presenting complaint. What's the problem? Difficult to initiate the movement. So now do the odd part of the walking problem. Can you tell me more what you mean by difficult to initiate or to start movement? What makes it challenging for you to start walking? Do you feel like there is pains in your joints? Is there any stiffness in your joints? And which joints are mostly affected? After you have managed to start walking, does it get better? Is there any particular time of the day you experience this problem? And when did all these problems start? We said 3 or 4 months ago. Generally, do you walk independently? Or do you use any walking aid, like for example, walking sticks or Zimmer frame? No, this particular gentleman, normally he walks independently. Now, other than difficulty initiating movement, are there other problems? Are there other tasks you find it challenging to do other than initiating walking? Do you have problems getting out of the chair? Do you have problems turning in bed? If they have problems turning in bed, getting out of the chair, what makes it difficult to get out of the chair? What makes it difficult to turn in bed? Do you have pain or stiffness? And if so, where are the pains? Other activities continues. What about holding on to objects? Any problems with that? Holding a spoon or forks, opening door, holding door handles, buttoning your shirts, dressing in the morning. So they are the kind of the effects of the symptoms on patient life. But we want to find out all the activities that the patient finds it difficult to do other than walking. And what makes them difficult to do. Try to ask what makes it difficult to do. Difficult to grab because there is weakness in the hands or because of the tremors. So next, the differential diagnosis. Parkinson's disease. Any tremors in your hands? Yes, he has got tremors. Do you experience tremors at rest, which means when you're doing nothing? Yes, there is resting tremors. Do you experience tremors when you're trying to reach or point at something? No. Which part of the body do you experience tremors? The right hand. Okay. Yeah. Parkinson's disease, what else we can ask? Do you feel that you are slow in doing things? Hypokinesia. Do you experience stiffness in your joints? Rigidity. Have you had any falls recently? Balance problems. Any difficulties buttoning your clothes or opening your jars, for example? how they are being affected because of the tremors. Any difficulty turning in bed, all these suggest Parkinson's disease. Yeah, remember it's bradykinesia. Yeah, it is rigidity. Okay, good. Now, next differential is drug-induced Parkinsonism. Yeah, first generation antipsychotics are more likely to cause Parkinsonism. First generation is haloperidol, yeah, chlorpromazine, yeah, these medication, flupentazole, yeah, flufenazine, yeah, zolpidem. They are the first generation. Or the second generation, like olanzapine, yeah, clozapine, risperidone, quetiapine, are less likely to cause Parkinsonism. Other group of medication may include antiemetics. Yeah, so it's just correct that it's antiemetics. Okay, antiemetics like prochlorperazine, metoclopramide, they can also cause Parkinsonism. Yeah, there is more medication that can cause Parkinsonism, but we're going to look at these common ones. Now, other medical condition you can ask is a stroke, previous stroke or previous TIA. Lewy body dementia may mimic Parkinson's disease. Okay, rheumatoid arthritis, joints problem, difficulty to walk. Okay, so swelling of the joint, symmetrical joints affected, any other tremors. There's no tremors in Parkinsonism, but it will be difficult to walk. It's going to be difficult to handle things, but there is no difficulty in initiating movements. Okay, but the daily activities may be affected similarly. Cerebral problems, stroke or tumor, yeah, may cause a balance problem. Wilson's disease, yeah, there will be history of dementia, there will be joint problem, there will be hepatitis, liver problem, Kaiser facial rings in the eyes. Huntington disease, there is a strong family history. It's an autosomal dominant. Yeah, okay? So almost always there's a family history. Creutzfeldt-Jakob disease, blood transfusion, tattoos, all those ones. Yeah, they can present it similarly. So after taking the history of the differentials, you do the PMF, those are the eye-state effects of symptoms. We do examination, check the blood pressure in this particular case, check a neurological examination. Okay, we need the cranial nerves examination, lower limb, upper limb examination. We need to check the gait of the patient. Okay, then you're going to find in here, they'll give you the findings. There is resting tremors of the right hand. Yes. Okay, cogwheel rigidity, pill rolling tremors of the thumb, pill rolling tremors of the thumbs, cogwheel rigidity. So let's write this one. Okay. Shuffling gait when walking, monotonous speech, difficulty initiating the movement, slow movement. Yeah, so give you the findings that are typical of Parkinson's disease. Okay, then explain the diagnosis. It's a Parkinson's disease. Okay, a chronic condition in which part of the brain. What is Parkinson's? Okay, it is a chronic condition in which part of the brain becomes progressively damaged. The cause is not known. The body needs a chemical called dopamine, which is produced by some special cells in the brain. When these brain cells are damaged, the brain cannot produce enough dopamine, and that may affect your movements. Sometimes Parkinson's disease runs in the family sometimes. Okay, but it's not a genetic disease where we can say for sure what the chances of your son or any children to get Parkinson's disease. But having a family member or having a parent with a Parkinson's disease does put you at risk of developing a similar condition. Okay, it is generally a slow progressive condition. Parkinson's is a slow progressive condition. So what you're going to do from a doctor, we're going to refer to the neurologist agent. So agent referral to the neurologist within a few weeks to be seen. What are they going to do? Explain what the specialist will do. We'll start with the basics. What did we discuss? When you're explaining what the specialist will do, start with the history. So we're going to say they'll ask you questions about your symptoms. They will examine you. Okay, they will examine you. Then they're going to do investigation. What investigation? Investigation, like, for example, MRI scan or CT scan. Okay, they will confirm, the specialist will confirm the diagnosis. Once the specialist confirms the diagnosis, specialist may start you on treatment. The typical medication they may give is what? Dopamine or levodopa. Dopamine, yeah? Generally, the treatment of Parkinson's disease is multidisciplinary, which means involving different specialists like physiotherapist, occupational therapist, speech and language therapist, specialist nurses, yeah? Specialist nurses, yeah? Parkinson's disease specialist nurses. Okay, and the treatment may aim at controlling the symptoms such as the tremors, for example. Okay, Thank you.